Hey guys, this is Dr. Matt Symons, and I'm from Palm Beach Health Center. I want to take a moment today to talk about the safety of chiropractic care for infants. Like, whoa, I know a lot of you are probably thinking, how could you adjust a baby? You know, it's going to hurt them. And it seems like, you're thinking chiropractic and infants would probably not be a good idea, but the reality is that, even the birth process itself, which, whether it's vacuum extraction, forceps, or manual pulling and twisting on that baby's neck, is a lot worse than getting adjusted. So I want you to kind of think about it from a different perspective. If you were to lift up a full-size adult, you'd have to use a very different technique, a lot of different forces than if you were going to lift up an infant. Yes? Right? So the same thing is true with chiropractic care. When we're adjusting an infant, it's usually done with just like the little fingertips, even the pinky fingers, and it's very when and the little bit of pressure is being applied, usually not even using a lot of or any thrust. But as they get a little bit older, when they're a toddler, you might want to use an instrument. Our kids in the office, they laugh and they call it the tickle stick, but a little arthrostim or an adjusting instrument, like just a little tapping on the spine. Maybe around 5, 6 years old, we might want to start just making sure that the joints are moving properly, so we can just run our hands across and fingers across the top of the spine and provide very precise little adjustments. It's at the point where they are, their spines still really move very nicely, so you don't have to use a lot of force at all. It's very gentle, it's very easy. Most kids absolutely love it. It's not until later on in life, when after people have developed a bunch of scar tissue and things have become more rigid and set, that it requires any more force that we would use on an adult. So just keep in mind that chiropractic care is one of the most gentle, safest, and most effective ways to take care of kids. The truth is, there's dozens, if not hundreds, of techniques that can be used, even on adults, that are considered to be low force or no force techniques. Depending upon what you're adjusting and who you're adjusting, someone has osteoporosis or osteopenia, there's all sorts of different techniques that can be used, and most chiropractors know multiple techniques and can make the right decision as far as what technique should be used for that individual. When it's the right time to use this technique versus that one, and make sure that they're getting the best results for people in a very safe way. And the safety of chiropractic for infants is actually unparalleled. It's much safer than baby aspirin. Even baby aspirin for adults, for heart disease has just been taken away because it's been causes hemorrhagic strokes and bleeding out ulcers. But I digress. Is there a need for chiropractic care for infants? Well, if you just do a little bit of Google research, you can find dozens and dozens and dozens of articles about chiropractic care, helping out with anything from ear infections to colic to keeping kids away from having anywhere near as many frequent colds or infections. In fact, one research study that I saw when I was still in school was a survey that was sent out to pediatricians that had their own children and chiropractors that had their own children, and they were talking about the health of their kids and how healthy they were and how many times that they had dealt with colds, how many times they had ear infections or experienced things like chickenpox or measles and things like that. And what they found was there was a lower incidence of sick kids in the chiropractic realm. Certainly there was lower incidence of measles in the pediatricians' kids, probably a much higher level of vaccination, I imagine, but the chiropractic parents reported that, yes, their kids might have gotten the measles, but it didn't slow them down at all. It didn't even interrupt their playing. They didn't have to do anything differently at all. It was just like this rash that just showed up for a couple of days and then it was gone. There was a much lower incidence of ear infections in the kids and colds in the kids from the chiropractors than they were the kids at the pediatricians. And there were many other findings as well, such as the number of days of schools that had been missed were much lower in the chiropractic kids than in the pediatricians' kids. So there's really quite a lot that can be done to keep kids healthier with correcting their subluxations by making sure that their nervous system is working tip-top. Thanks so much. Hope you enjoyed this.
Awesome.